background is I was trained as a pediatrician, as almost all pediatric rheumatologists are from their background. So I'm pediatrician in the first place. And then within the field of child health, I got interested in rheumatology and in inflammatory diseases. I became actually first involved in research on inflammatory bowel disease, then immunology, and became finally, with a subspecialization, a pediatric rheumatologist. And now I'm a professor, a full professor for pediatric rheumatology and immunology at the University of Muenster. And so I'm in a quite good position to do translational research, live as a clinician scientist, and care for children and adolescents with rheumatic diseases. As all the committees within EULAR are relatively newly formed, also the pediatric committee is finding itself, I would say. And the main role is to represent the perspective of the pediatric rheumatology community in the first place. It's a so-called community committee. And so we want to bring in the perspective of children and their families who suffer from rheumatic diseases into everything EULAR is doing. And we do this by connecting people who are pediatric rheumatologists and involved in also the society for that. It's called PRESS, so the Pediatric Rheumatology European Society, with those who represent pediatric rheumatology on different content committees, for example, quality of care, or advocacy or research. And so we want to bring in our perspective and the perspective of the pediatric rheumatology side, what children need, what the families' needs are, into everything that EULAR does professionally. And this is, I would say, on its way. We are already doing it. We have a lot of combined activities, and it is also very much highlighted, of course, in the congresses, in webinars, and I think this will be a brilliant way of connecting the societies also and bringing professionality into the field of pediatric rheumatology in the future. EULAR has become really professional on the one hand. It's a very large organization and powerful also. So there are a lot of opportunities, I would say, to really move the field forward. And together we can do this better than alone. So as an example, for pediatric rheumatology, this would be very difficult to do because within medicine, it is a niche. Only very few kids are affected if you really count them. Although it is a very important field, and EULAR is powerful, it has its voice, and it is professionally really moving the field forward. So we can benefit a lot as pediatric rheumatologists from that. Kids suffering from rheumatic diseases can benefit from that. And I think EULAR can benefit from this side also, because there's a live perspective, there's the perspective of all the people in the world suffering from rheumatic diseases. And this includes kids, this includes adolescents, of course, and it has this perspective across ages that we can bring in. So there's a lot we can do together, and I see EULAR really on a very good way to do that in a very powerful way. So we connect with EULAR and other professionals within EULAR already. We have a lot of endeavors and projects, because also members of the pediatric committee are involved in the content committees such as the research committee, quality of care, advocacy. And so already there we have a voice and we are involved in the projects, and in the pediatric committee we try to bring together all these information, also the news and the projects and the opportunities that come from the other committees, and so we are already very active in there. I think there are a few things that could be improved as always, so we could get more involved in certain initiatives. But this is a matter of time, and I think the pediatric committee will take care of the communication between all these groups, and with that it will grow.